אנחנו מתחילים להצטרף, יש לנו 20.
Good day, everyone. We will just wait a few minutes till we'll have more people joining us. All right. Good morning and good day, everyone. Thank you for joining us for this presentation of Inmode. Morpheus8 is our subject today, as we have some news regarding tips, and we shall just start now. So I hope everyone is well connected and can hear me well. If I may kindly reserve your questions to the end of the presentation, and then I will be more than glad to answer all your questions. Just a second. Okay, cannot. Can see me? Yeah. Yeah. Oh, for those of you who don't know me yet, I'm Dr. Eran Krieger, MD, and I'm part of the clinical department in Inmode. So we shall just start seeing this short video. So, yes, we are happy and proud to introduce two new tips for the Morpheus8 that we're going to see now. The 12 pins for small areas, and the 40 pins, 40 needles tip for the body, but we're going to see it in a minute. We will review some of the concept that maybe you already know, but it's good to see once again and to emphasize those points that are really crucial and important. So the first thing that I would like to mention is that the needles, as they go through the skin, they will just be activated. They emit. The emission of the RF signal is just in the very end point of the needle, as the rest of it, so the whole body of the needle is insulated, is covered, is coated with an insulation material. So the emission of the RF energy is just in the end of the needle, in the last, let's say, ½ millimeter at the point of the needle. So if you work in 4, 5, 6, whatever, the emission of the RF will be delivered just in the very final point of the needle. So we can work in cross-sectional mode, means in different layers, starting deeper, let's say even today up to or down to 7 millimeters, and going up. So we can cover different layers, starting at the hypodermis, at the subdermal layer, and going up to the dermis and to the epidermis layer. The treatment targets, again, the MORPHEUS8 applicator can be used in different clinical indication, such as wrinkles, fine wrinkles or any other wrinkles, scars, atrophic scars, post-acne scars, in skin laxity, in facial skin laxity and body skin laxity, some dyschromia, if it's very superficial. We can treat stretch marks and cellulite more than ever with the new 40 pins tip. Let's see a short video showing the real interaction with the tissue, even with the fat tissue. As we can see here, we have a flap of abdominoplastic live, just as the surgeon has cut the piece, and you can see the small sparks around every single needle that goes in. And this is what I would like to show this again. So in every point that you can see the spark, we have the ablation and coagulation part around that area, and this is how it actually happens live. Here we can see it very well in this anatomical part. Histologically, when we examine the tissue after a while, immediately you will be able to notice very clearly the crater that is made while the needle penetrates the skin. So there is the ablation zone, and underneath we can see a very large coagulation zone, and another area even deeper is bulk tissue heating. So it's not a specific heating, but it just all over heating, and it's of course affect also the skin and the tissue. A couple of weeks after, you can see a very nice healing of the area. You can see the epidermis that is a bit thicker due to hyperactivity, and a nice remargining, a nice healing of the dermis all over, with the presence of fibroblast that is colored here, and you can see it very well. So there is the response, the healing response is very clear, is very pronounced in this histological referred, and you can see very nice what happens in the tissue after using the Morpheus. So regarding the whole concept of fractional, ablative fractional, using microneedling, we can divide into two different, let's say, entities of damage. One is made or induced by the mechanical passage of the needle itself into the skin, and the second one is the thermal damage, of course, that is induced deep in the point where the needle reach. So the first thing is a shrinkage, of course, regarding the dermis, the sorry, the collagen, the fiber, the protein tertiary structure fibers, the triple helix that is get shrink due to breakdown of hydrogen bonds in the protein structure that will make immediate shrinkage, and this is the first thing that we can observe using the radio frequency, the thermal effect, let's say. And we can see as well in the second day on, or even eventually after a few hours, a process of reepithelialization, means the healing of the epithel the epidermis upper layer that is getting once again it's synthesize itself, it reproduce and it heals the tissue in order to close actually the craters, the holes that were made by the penetration of the needle. So this is the damage actually that once again can be evaluated as a mechanical damage and thermal damage that together give us the result. The side effect that we can observe actually immediately after, some of them can even be considered an endpoint of the treatment, is an erythema and edema of the in the tissue, in the epidermis. So we can see the redness and some swollen around the area that we treated, that normally fade out in 4 days to up to 7 days. Depends, of course, and in the way that we treated, the depth, the power, the energy, but we normally will be able to observe this erythema and edema. Sometimes we can even see pinpoint bleeding, so a very small, fine capillary bleeding, which is absolutely normal considering the rich vascular network that we can find in the dermis. However, the long-lasting effect that we will be able to observe, and this is what we are looking for, will occur later on as a response, as a reparative response to the damage, to the controlled and desired damage that we have just generated. And this response is the generation, is the synthesis, the production of new collagen, of new material of the tissue. So it can renew itself, and this is actually the final or the long-lasting effect that we are looking for. So the idea of fractional is taking advantage of the healing point. The damage is not total, is not all over the area that we treat, but just in very specific points that the needles penetrate the skin. These points are considered healing point, as the skin repair itself, starting from the healthy, the intact area around the points of penetration. And this way we can have a resurfacing and healing of the damage that we have created. So we will be able to see as a result new collagen fibers and new elastic fibers, elastin as well. We can, due to intensification of the fibroblast activity, so there we will see also the extracellular matrix production of hyaluronic acid, of GAGs, glycosaminoglycans, that of course needs to help the tissue in healing the whole area. As a consequence, we will have also water retention because of the polysaccharides, because of the extracellular matrix. So we will have a volume augmentation beside the intensification of the fibrotic network of the collagen that also will support and tone up the tissue. So we can move on, and now we can see the new set of the tips that we have today that we can offer. So starting from the well-known resurfacing, here it shows the depths of penetration between 0.5 to 0.75, but the second value, so in this case the 0.75 millimeters, is referred to the thermal excursion, so to the development of the thermal damage once the RF emission is in the tissue. But the length of the needle is 0.5, 4, up to 4 or 7 millimeters. So the rest of it is the damage that is created around the area of the RF emission. So once again, resurfacing just for the epidermal layer, 0.5 millimeters. The MORPHEUS8, it's 24 needles up to or down to 4 millimeters. Prime with 12 needles for small areas down to 4 millimeters, and the body tip with 40 pins. I can maybe show you, oh well, this is how the 40 pins, 40 needles millimeters look like, and the small one, the prime, which is the, I hope they can see it, all right, is the 12 pins. Some of the specifications that are common to our tips. So the 12, 24, or 40 sharp coated needles, the diameter of 300 microns, and except, and they are all coated, they are all insulated, except the resurfacing, which is the 0.5, the half millimeter tip, which is not coated. They all have the return electrode grid that symmetrically surround all the needles, so we have the distribution of the RF energy is absolutely homogeneous along the all tip area, and this is something very important. There is a synchronization between the needle's penetration, means that the RF energy will be emitted once the needles are in the skin. And of course, we have the ability to work in different layers as we decide the depths of penetration of the needles. So beside the resurfacing tip that is not coated, all the others are, and we have, I'm sure you remember it, but just to say it again, we have the cycle mode and the fixed mode. The cycle mode is the mode in which in each pulse the needles are pulled into the, or pushed, depends how you look at it, into the skin and come out every time we push the pedal. While the fixed is the needles are going in and stay in the skin, and as long as we push the switch, we activate the pedal, the RF energy gonna be emitted repeatedly. So this is what we call stacking. So once again, cycle, we can work with one penetration of the needle bench into the skin, and we can do it single, or we can do it faster, and then we will have to move the our applicator, and each time we have one penetration of the needles and one emission of the RF signal. And in fixed mode, we have the penetration of the needle bench into the skin, it stays there, and as long as it is activated, we will have emission of the RF energy. All the tips come when they are sterilized, gamma sterilized, and they are made for a single use only. This is for, of course, legally and for regulation. I know that some operators around the world would tend to reuse the tip. If they do so, we would recommend to conserve the tip for the same patient and to clean it with a sponge with alcohol. If I can have just one, I would like just to show how we do it, because the same way that we would like to conserve the tip, eventually we need to clean it every 200 penetration pulses. So, oh, thank you so much. So we have this, I'm sure you all know this alcohol swabs pad. So actually we can take the tip and hold the pad very tightly like this, and you can do it, of course, while the tip is on the machine, activating the machine on the maximum depths. Okay, so and then we do it like 2, 3, 4 times. We clean this way, and we have, let's say, it's not a full disinfection process, but we can move the impurities, the residual impurities, and we can keep this way. And in this way, eventually, by moving the impurities, we also once again achieve a good coupling, a good resistance. So we reduce any resistance, electrical resistance that may be accumulated during the procedure. So this is something that we would do once every more or less 200, 300. If we move from one zone to another, it's good to clean the needles in this way. The tips are, the needles can be used for more or less 1,500, 2,000 penetrations. Then we would recommend to change the tip to a new tip, as of course we can have some reduction of the sharpness of the tip of the needles. Let's summarize. MORPHEUS8 body with 40 needles. Penetration depth of penetration is up to 7 millimeters. Let's say that the 7 millimeters penetration depth is cleared as regularity for some countries, not all of them. We are actually now working on the authorization for these steps worldwide. So I hope that in all the countries, the states, we will be able to have this regulation clear. The energy level can be set between 5 to 60 in the large applicator, in the body applicator, and if of course it can work both in cycle and fixed mode. The 24 pins that you know, I'm sure, the MORPHEUS8 is called, is up to 4 millimeters, and from 5 to 60 is the energy level. If we use just 1 millimeter, it's limited to 30, the energy level. Also here, both modes, cycle and fix. The MORPHEUS Prime is the new small applicator, the 12 needles, 1 to 4 millimeters, and also here, 5 to 60. while if you work on 1 millimeter depths, the energy is limited once again to 30. Both modes are possible also here. The resurfacing, of course, is a fixed mode, so there is no mechanical penetration with the engine that push in, but it just plate. It's a manual, so you lay the you position the applicator, you press it firmly, and you work. So we speak about 0.5 millimeter, and the energy level, since it's very superficial, we don't want to create to be too much aggressive, so it's up to 30. And of course, cycle or fixed mode are not applicable as there is no motor movement. The interface is the regular, the one that you can see, or maybe there is even an update regarding the visuality of the interface. However, you will always be able and need to set the tip. So resurfacing 12, 24, 40. The depths according to the tip up to 7 millimeter. The energy according to the tip and the depths up to from 5 to 60. And the mode, cycle and fixed. And you will have the counter reset that you can see how many pulses you have done for one zone. The areas that we treat, and the indications. So the small, as you can imagine, small tip for small area, therefore for delicate area like the perioral, the periorbital, temples, for wrinkles, laxity, any problem, but of course for those areas where the access is quite difficult, the areas that are delicate, and the most indicated, I would say, of course facial, but is around the eyes, and the upper lip is a very good area or indicated for this tip. The superficial treatment for resurfacing. So once again, here we don't have a real penetration of the needles. Speaking about 0.5 millimeter, working superficially for in the epidermis, and eventually the junction dermis epidermis for resurfacing. The MORPHEUS8 24 pins for soft and bony areas of face, neck, wrinkles, on acne, on the atrophic post-acne scars, macropores, skin laxity, and all the normal and treatments that we already do with the MORPHEUS8. Here there are no there are no changes actually that occurred. The body tip 40 needles is the new one that actually introduced for the first time not only large in terms of surface and therefore 40 pins. This is of course larger than the 24, but also allow to penetrate the skin into down to 7 millimeters depth, which is quite deep considering the skin. So we can work into the hypodermis, the subdermis, and of course coming up working in multi layers in also in the upper layers, dermis, deep dermis and upper dermis. So the treatment parameters for all tips, just a very let's say general vision of the treatment parameters. So treating facial and bony area, as we mentioned before, like periorbital, the forehead, the temples, chin, the penetration depths would be from 0.5 if we use the resurfacing tip, up to or down to 2 millimeters. The energy level not more than 30 for this area. We don't do stacking on this area. So cycle mode probably, or preferably single, as we use very small area and there is no need to hurry up the treatment. In this way we can treat precisely the area. Number of session it depends, as you know, but from 1 to 3, the weeks, the interval between a session and another, from 3 to 6 weeks. We speak normally about 1 month. 4 or 5 weeks is normally what we need to wait between one and another, but we can sometimes make it earlier, and sometimes we need to postpone the treatment. Downtime here also depends on the treatment, and it can range from 2 to 5 days. Sometimes even less than 2 days. We can see already a normalization, maybe a bit of redness, but the patient can get back to normal life. On facial and soft tissue, like neck or around the perioral, cheeks, 2-3 millimeters. On the face, we would not recommend deeper than this. Energy level from 20 to 40. Here we can use either cycle or fixed mode. Number of session 1 to 3, and the intervals again 3 to 6, as well as the downtime 2 to 5 days. The body areas, like the gluteus area, the abdominal area, is down to 7 millimeters according to the area, the situation, the condition. We're going to see it in a minute. So from 4 to 7 millimeters. The energy level here, of course, is higher as we work deeper, and this is a rule that we will always keep in mind. Deeper we go, higher can be the energy. And here we can treat both cycled and fixed mode, so we can do stacking when we work in these soft areas. Sessions also recommended is 1 to 3, as well as the other parameters, interval 3 to 6 and downtime 2 to 5 days. But if we consider the hands dorsal part or the décolleté, so these areas are quite sensitive, delicate, so we rather use less penetration, so we 2-3 millimeters, not more than this, and the energy should be reduced as well, 20 to 40 instead of 50. And here it's preferable to use cycle mode and not stacking for this not necessarily single, but not doing stacking. Number of session also here 1 to 3, and is the same. The procedure. So regarding the procedure, the application or the positioning of the handpiece will be always perpendicularly. We always have to keep and to position the applicator perpendicularly 90 degrees, so there is a good contact of all the electrodes to the skin. I just would like to mention that we should always work on clean skin and dry. So we'll do the cleansing with alcohol before we dry, and then we can work on it. Complete contact, firm pressure, we just said it, and we activate with the foot switch. And here it's important to decide if to work with the rhythm of work, the speed. So if to work single or to work faster than this, according to the area and the experience that we have. The overlapping of the area is about 30 to 50%. It's important not to do it, otherwise we will be able to see this space of the electrode where the needles are just in the middle, of course. So in these areas, in these margins, we need to cover it by overlapping, otherwise we will have to repeat again, because the footprint will show you this square area. All right, a short video of
This is Morpheus8.
In this case, of course, the procedure is done after a minimal invasive, just to enhance the results and to give also firming, tightening to the skin texture. Okay, so yeah, that was one of our doctors. Cellulite is actually a new indication for the Morpheus8. Not totally, but let's say that the new tip and the ability to penetrate into 7 millimeters gives a very good chance and way to treat this kind of problem, which is cellulite. What is cellulite? It's a huge argument, actually, a wonderful one. But I would just like to summarize it very shortly, as really it's not, but to understand, because it's important to establish if we treat a localized adiposity or cellulite or panniculopathy. So cellulite is a microvascular connective, as the connective tissue, the dermis, the collagen is involved pathology with sclerotic evolution, because we can reach in the fourth stage a real fat dystrophy of the subcutaneous fat. So it has a genetic predisposition, and some other factors of neuroendocrine factors in certain age are involved, especially estrogens in women, that set on this clinical condition, and which can get worse by some, let's say, pejorative factors that regard lifestyle and diet. So it mainly affects women, Caucasian women, more than 80%. In the age over 30, we can somehow see cellulite. So as I said, there is a genetic predisposition background on which is established a neuroendocrine factor, the secretion of estrogen in a certain age. Then we have, for some reason, a microcirculation deficiency with hypoxemia, and that induces an edematous stage, so swollen. Then we have an abnormal reaction, fibrotic reaction of the periadipocytes, fibroblasts that produce collagen, produce fibers, and this situation just is a vicious circle that continue, and it gets worse and worse. So according the European, actually the Italian Society of Aesthetic Medicine, the panniculopathy, dermatofibrosclerotic, that so-called cellulite, is divided into 4 stages. So really shortly, the first stage, we have this alteration to the microcirculation. That's all with a bit of swollen of edema. This stage is actually reversible. Then we have the second stage. It's already involves I would call it a reaction, but an activation, abnormal activation of the periadipocytes and pericapillary fibrous reticulum. So there is a production of synthesis of fibers. Then we have the third stage, the formation of what we call micronodules, microstructures or micronodules. This gives the appearance of the famous orange peel, and then it gets worsened even with the formation of macronodules and the mattress aspect, and this is already speaking about a dystrophy and so on. So we can treat this problem, which is something really I would say revolutionary, as many of the technologies of all the therapeutic methods are not that efficient. We can really treat the cause here by using our 40 needles tip, and so we can actually remodel the, just a sec, sorry, it gives me a bit of, oh, this is the way we just treated the, no, sorry, I'm sorry. Oh, let's see, I hope it's, okay. Sorry, the video is not working, but anyway, I'll try once more to see if there is any respond. It just worked perfectly before, but you know, technical issues may occur, so never mind. We work in this video on this patient that you have just seen before. Is the same one that I showed before, the area treatment, the treatment area. So we use the 7 tips, the 7 millimeters tip, sorry, and we did 2 passes. The first pass was with 7 millimeters. The energy was 40, and we made 2 stacks, so in fixed mode. The repetition rate was 1.5 pulse per second, and then a second pass after the cleansing of the tip, as I showed you before. The second pass was with the same tip, of course, the 40 pins, the body, but 5 millimeters. So we actually acted on first on the really in the hypodermis, then we went in the subdermal. Yes, it's still hypodermis, but it's up, so it's more fibrotic, and we did the same thing, but with the cycle, with the 5 millimeter depths, and in 1 pps was the rate. So one pulse in a second. So 2 passes with the body tip, 40 pins. First was 7 millimeters deep, and then a bit upper 5 millimeter deep. This is actually the end point of the treatment, of course. I assume that we will need to treat again 1 or even twice, and hopefully we will see some nice results on this lady, which is one of our staff. Here we treated really recently with the 40 pin tip and laxity after diet and giving birth. We have this abdomen laxity. This is really a dermal problem. So this is the situation that you can see 2 days after. So it's a nice improvement already, and of course this lady also need to be retreated, and we will be able to see even a better result. Here we did 3 passes. The first one with 7 millimeters, of course all of them with the body tip. First 7 millimeters, 35 was the energy, stacking 2 stacks, repetition rate was 1.5. Then we made we performed the second pass with in 5 millimeters. So we a bit went up in the layer again, cycle 30 and 1 pulse per second. And the third pass was right to the dermis, 3 millimeters, 25 the energy. You see how the energy would tend to be reduced as we climb up the skin. And also here was 1 pps, pulse per second. We cleaned the tip between each pass and another, and of course at the end. Here we treated with the new small prime 12 pins, the upper lip of this lady. It's we actually the exact indication was what we call the barcode. Is ex-smoker. This lady smoked all her life, and we have this vertical lines on the upper lip, so-called barcode. And we did here 2 passes. The first pass is 3 millimeters. 30 was the energy. We did 2 stacks in fixed mode, and the second pass just 1 millimeter 30 and cycling in 1 pulse per second. During the whole treatment, and this we have done also in the previous one, in the cellulite, we keep cooling. It's important to cool the area. We used simmer, but you can use other methods if available, like ice packs. Just want to mention that you can see some pinpoint bleeding in this area. Is very vascularized, and it's quite often, so it's normal to see here some bleeding. At the same time, pay attention if you have visible vessels, blood vessels that are very superficial and large. Stay away from this. With this tip, we can also treat very nicely and precisely the eyelid. So by moving the skin, stretching it down, we can really work in the all over the eyelid. In this case, of course, the depth would be 1 millimeter, maximum 2 millimeters, not more than this. But it's also very indicated for this area, as we said before. So the eyelids, the upper lip, and the small areas that we need to access, and it's difficult to do it with the large applicators. Right. Here we have some before and after pictures of the MORPHEUS8. Here is a resurfacing of Dr. Mulholland. Energy was 30. In cycle mode, just treated all the area. Post-treatment, the cooling, as I said before, is important during the treatment itself, but it's recommended to also to cool the area immediately after. Then we apply normally after the treatment with Morpheus an antibiotic and cortisone cream. Just 1 application immediately after. The antibiotic normally is gentamicin with any hydrocortisone or betamethasone. Normally they are associated in topical cream. It's good because it prevent from any infection, and it reduces the inflammation. So it's good to apply after such a treatment this cream. Of course, it's not necessary, but it's recommended. You can also use trolamine cream or any other cream, but just that keeping in mind that you have the craters open, so don't apply anything that is not medical into it. No perfumes, not lotions or things that are cosmetics, just for after treatment. As soon or few days after, 1, 2, 3 days, according to the conditions, to the situation, the patient can apply any cream, lotion, makeup whatsoever. So we can treat, as we said, both deep and superficial, from 1 or even less if we do resurfacing, down to 7 millimeters. We have a very homogeneous, uniform effect, and actually the downtime is not that bad. Speaking about a couple of days of redness and swollen, and we can treat the whole skin type with caution regarding dark skin type, because they tend to create post-inflammatory hyperpigmentation, and we have to keep energy and the way of working a bit more sensitive, delicate, and not to act too deep or too aggressive. Results. So let's see few photos before and after. We have the Morpheus. I guess we saw it before. No, this is from Dr. Roth. Energy level 50, 2 and 3 millimeter. Neck 2, 3 and 4 millimeter. The opposite, yeah. Of course, 4, 3 and 2. But we can really see nice results in the area of in the neck area. Yeah. The acne, it's not very active, but it's still an active acne, and a bit of scars, but it's still active. Here we don't have all the parameters, but we have this picture coming from Asia, treating the acne. Also here we have acne and some scars. So we treat the whole area as if it was one problem. With the Morpheus8, we treated here 3 millimeters. Energy was 40, 3 stacks, so fixed mode, 3 stacks and 2 passes. Nice result. We can see a real change of the texture and okay, a bit of laxity in the knee area, upper knee. Here we have also 4, 3 and 2 millimeters, so different layers, 1 pass in each layer depth. Energy level was 35, and also here we have some improvement of the skin.
Because of the curve, they use the ordinary, not the body.
Oh,
the curve of the area.
Okay. Well, in this case, the tip used was the 24. The 24.
Not the 40.
Not the 40, as we have some curved area and some difficulty in the access for all over around. So just to have a good positioning, they used Dr. Duncan used the 24 normal regular Morpheus8. Here we have also treatment with the Morpheus8 with 4 millimeters, but a very nice result.
She didn't have the 7 millimeters.
Yes, at that time it was not still existing the 40. So we have also nice results with 4 millimeter, with the 24 needles and 4 millimeters tips. Here we have cellulite 3 weeks after. Dr. Judy Hellman using the 40 tip, the 40 pin tip, 3 passes with 6 millimeters, followed with 3 passes by 3 passes with 3 millimeters at 45 energy level. It's a nice result. It's a nice outcome, because we can see how the texture also here change. We can see that all the bumps and dumps were disappeared almost totally, and there is a nice skin texture. Another way to evaluate the improvement is to see thermography of the area before the treatment and after the treatment, as we know that cellulite has one of the most common and first symptoms is the hypothermic zones. So once we activate, we stimulate, we're going to see new vessels, neoangiogenesis, and the circulation, the capillary, the peripheral circulation is improved. So you will be able also to detect a better peripheral external circulation. This is also something that can be done. Thank you very much for your attention, and I will be more than happy to answer your question if there are any. Yeah, wow. Please expand your screen. Okay. Oh, what is the meaning of prime?
She means purpose. I think she means what's the purpose?
I think that maybe it's a new name, so she's not familiar with it. Prime tip is the small tip. If this was the question, the purpose of the tip is a small one, so it's meant to be used in very small areas, as we mentioned before. Just a second. The new clinical bulletin that you sent is penetrate pin through alcohol pad. Well, the thing with the alcohol pad is it's just for the cleansing, of course. So we take the pad, we take the once again, and I will show it. And we press the needles. That's all.
Several times.
Okay, several times. Yeah. Then let's see. Yeah. Our customer need treated zone of ablation and coagulation in each parameter settings? No. The coagulation and ablation is something that happens each time that we use the needles, the Morpheus, according, of course, the depth of penetration. But in the area where the RF is emitted, you will have an ablation zone, a coagulation zone, and just a bulk heating.
Not necessarily on the surface, maybe.
No.
Ablation internal.
This was not the question. Okay, never mind. Thank you. Great webinar. No more questions. Thank you very much. Anne from Germany. Thank you, Anne. Are combinate cellulite morphous body tip? Yes, certainly. Certainly, yes. The body type would also be, of course, is invasive, and we penetrate with the cannula, and we do much more than we do, so we can eventually even evacuate. We can model in more let's say concrete way, and then we can use the Morpheus for the remodeling of the dermis, and to also to enhance the firming of the tissue, the tightening of all over. So yes, can the new body tip melt adipose fat? Well, melting is a big word. I wouldn't say melting because remember that we work in a very precise point. But where there is ablation, there is an ablation. So we do damage irreversibly fat tissue for sure. But we cannot think of it, of the Morpheus, as something for fat reduction. This is not the purpose. We do want to act on the fat tissue. In the case of cellulite, to work on remodeling all that network and to reduce a bit of what is possible, also to work on the clusters of the adipocytes, but it's not for circumferences reduction totally. No, it's not. It's once again the fractional RF microneedling is for to firm, to tight, to tone up. This is the main purpose of this technology. So I hope I answered your question. Any other questions? Dr. Ella Goen would like to say something, so please.
Hi, everybody. Thank you very much to Dr. Eran Krieger for perfect webinar. I just want to mention one thing about the difference between Fractora and MORPHEUS8, because a lot of the customers still have the Fractora, and it's not totally useless. You can still use and have some advantages. Basically, the advantages of Morpheus over Fractora are that the needles are thinner, they're round in cross section, so they give less injury and downtime is shorter. The return electrode is surrounding every needle. It makes the energy distribution more uniform. And so the only, I would say, disadvantage is if we need a surface ablation, because ablation can also occur inside the tissue, of course, but a surface ablation for deep wrinkles, deep acne scars. Of course, the internal ablation also helps, but if you do have the Fractora, it might give a better ablation if you use especially the non-coated 24 pins, because this gives you a 2.5 millimeter. The Morpheus resurfacing tip is only 0.5 millimeter. So you may need for resurfacing more passes, more sessions with the Morpheus. So if you still have the Fractora, I think this specific tip will be very helpful to supplement the results of the Morpheus. So that's what I wanted to add, and thank you again for joining us. Thank you, Eran, for a great webinar.
Thank you.
Bye.
Thank you very much. Bye, everyone.
Luffy.